on behalf of the Wellness Committee and the Wellness Clinic. And I think you know the three ladies up here. We have Ann Lipscomb. And Ann tonight, well, let me tell you a little bit about Ann. She attended UT Austin for both her nursing degrees, her BSN and her nurse practitioner training, and MSN, Master's Science of Nursing. She has enjoyed practicing as a family nurse practitioner at several sites in Austin since 2003. She lives with her mom and their 4 dogs in Central Austin, loves swimming at Barton Springs, hiking and gardening. So we will kick off our program this evening with Ann, and then Kathy Cody will follow. And Kathy's been here at Westminster for approximately 12 years. And Kathy has a whole lot of letters after her name. Many of you, if you picked up her card from the Wellness Clinic, you can see it's mostly letters behind her name. She has a master's and a doctoral trained nurse practitioner with 20 years of experience working as an NP nurse practitioner in geriatrics. She has been working with Westminster for 12 years. With her leisure times, she does traveling and spending time with family, and I just learned she has a bunch of dogs too. And she also worked as a medical technology out in California. And then to bring up our program, we've got a very learned young woman that came here and worked here, practicing, learning from Kathy Cody almost 2 years ago, okay? Mindy Copley. Mindy graduated from UT Medical Branch in Galveston with a master's degree in nursing in 2019, and was fortunate enough to spend several clinical rotations at Westminster with Kathy. And in her free time, she enjoys reading, playing piano, and singing and crocheting. You must not have any dogs.
I have one very fat grouchy cat.
Oh, grouchy cat. And on that note, we'll start with Ann Lipscomb. Thanks, Ann. Thank you, Kathy.
I get to take off my mask. Sorry. Okay, so thank you all for coming tonight. It's nice to see so many familiar faces. Let's see. Okay, the topics that we were going to go over tonight are the services that the clinic provides, what the clinic can do for you. So the clinic is on the ground floor of the Preston building. Here's our phone number, 512-323-2395. It's on your handouts. We do take appointments. We really appreciate appointments, but walk-ins are also welcome and will be accommodated as the schedule permits. We're also going to talk about nurse practitioners, which are the 3 people that staff the clinic with a receptionist. Mindy, the 3rd person on the podium, works mainly in the healthcare center or over in the Arbor. So she will be in the clinic every once in a while to cover for Kathy or I if we're off for whatever reason. But by and large, you'll see Mindy in the Arbor and you'll see Kathy and I in the clinic. We're also going to talk about a new program for us called Chronic Care Management, which is a Medicare program that is for people with multiple chronic conditions to help to keep them healthy. Sorry. So the services that we provide at the clinic, we provide acute care. So that is what you might expect to get at a doctor's office if you wanted to be seen today. And you could get an appointment today. So things like colds, bad allergy symptoms, the flu. We can help you differentiate between those things, the colds, the flu, COVID, allergies, and prescribe medications to help you with relief. We also see people that have had falls or injuries or skin tears, have muscle or joint problems. We like to see everyone that's experienced a fall or an injury in the clinic, just to make sure everything's all right and to see if there's anything else we can do to help from accidents happening in the future. If you do experience an injury, even a simple little scrape or a skin tear, we recommend that you come by the clinic or call and make an appointment as soon after that as possible, because that we can really help you heal more quickly and more completely with that. We also treat people that are having stomach trouble, nausea, vomiting, diarrhea. I didn't put constipation in, but we see a lot of people that have constipation. So we're good at dealing with that. We also do, going back to the injuries, we do lots of bandaging. So we're also very good at bandaging. We remove stitches that you might have gotten in the emergency room or from your dermatologist or another doctor. We remove staples, and that might save you an office visit to an outside office to have those things taken out. We also are able to do in-office testing for bladder infections. So we can let you know right away, yes or no, does this look like an infection, and get you started on medication. And then we also see people that when you just don't know what's going on, but you know you don't feel good, you don't feel right. All of us are trained in diagnosis. So we're very good at going through all your vital signs, all your history, a physical exam, any lab tests we need to do, and trying to get to the root of what's going on. We also see chronic conditions. So high blood pressure, asthma, and chronic obstructive pulmonary disease, or COPD. We see folks that have heart trouble, like congestive heart failure or atrial fibrillation. We see people with diabetes, help them manage that. Also arthritis, both osteoarthritis and rheumatoid arthritis. Help people manage those, help with questions, help coordinate with your specialty doctors. So that's just a small amount of the list, but it goes on from there, but those are some common chronic conditions we take care of. The other kinds of services we do provide, which people are always very interested to learn about, we do clean people's ears. So a lot of people will come in every 6 months, every 3 months, and have us look in their ears, take out any wax, and that will really help with hearing and just general comfort. So that can be done by appointment. We also do what we call foot care, which is basically taking care of your feet, trimming toenails, taking care of ingrown nails, taking care of calluses, corns. We're certainly not going to do any surgery, but we can take care of your feet, help you keep them healthy. That's something that Medicare pays for, usually every 2 months. So we have a running list of people that we see every 2 months, and that also is by appointment. We also have an electrocardiogram machine that we can come to your apartment or do an electrocardiogram in the clinic. We have an x-ray service that the x-ray technician will come to your apartment and do an x-ray or an ultrasound in your apartment. And we write prescriptions. I'm always surprised, because I've been doing this so long, when people come in and say, well, can you write a prescription for me? And yes, all the nurse practitioners in Texas that are certified to dispense medication can do that. So here's the part of our talk about nurse practitioners. Nurse practitioners are often registered nurses that have then gotten advanced training. And that advanced training is usually between 2 and 4 years beyond an undergraduate degree or a bachelor's degree. So nurse practitioners collaborate or work in tandem with doctors in Texas. It's different from state to state, exactly what the abilities and the limitations of a nurse practitioner are. But in Texas, we do need to have a doctor that we're working with. We can write prescriptions, we can order tests, we diagnose and treat illness, manage chronic conditions, address acute conditions. We all have a state nursing license, and then we also have an advanced practice nursing license. And we all have national certification, which is above and beyond the state licensure. So how the nurse practitioners in the clinic work, or how the clinic system works. So you would come in with some type of problem, and we would get a history, sit down and talk to you, find out how long, how much, where, when. We would do an exam. We would come up with a diagnosis, a most likely diagnosis, do any kind of testing that we might need to do, including lab tests or an EKG or x-rays, and then we can go ahead and provide treatment for you. We do communicate with your other doctors, other providers. So for instance, if you came in for high blood pressure and we adjusted your medication, we would call and talk or send an email to your primary care physician and or your cardiologist. We can see you in the clinic, or we can see you in your apartment. Because of the number of people we see and that we make appointments, we try to see people, if they're able, in the clinic. But certainly if you have symptoms that seem like you might have a contagious illness, then we'd like to see you in the apartment. And we can always come and see you if you're so ill that you're not able to comfortably get down to the clinic. And then we provide follow-up care. So after we see you for something, give you a treatment, we'd like to be able to hear back, talk with you, find out, how are you doing? Did that work? Did it not work? Did it work partially? What can we do next? So that's also part of what we do in the clinic. All right, so that's it for me. I think we're gonna hold questions until the very end, but I know now Kathy is gonna talk about the chronic care management program.
Thank you, Ann. How do I get out of the other thing? I'm not good at the computer, I'm sorry. Okay, I got it. Okay. Because some of this gets kind of a little boring sometimes, I wanted to make you laugh first. Hopefully. So I found this little cartoon. And I don't know if you can see it from the back. It says 50 years ago, I spent all night in line for Rolling Stones tickets. Now it's for a vaccine. Okay, now the more boring part. Okay, so we have a new program here at Westminster. It's kind of new everywhere, maybe 2 years, maybe 3 years, I forget exactly when they started it. I have been doing it for a little over a year, but at first I just did a few test patients just to kind of see how it works, make sure we're doing it correctly. Since I got the first few patients, we also added an electronic health record. That's one of the requirements that Medicare has to do the chronic care management. So had to figure that out too before I could put more people on the service. So now that we've got that all figured out, I have been doing it initially, but now Ann and Mindy are also going to be doing some chronic care management also. So what is chronic care management exactly? So it's a program paid for by Medicare and Medicare replacement plans for a resident with multiple chronic conditions that place the resident at significant risk of acute exacerbation or decompensation, which kind of means a flare-up, or functional decline, meaning you have a progressive illness that's going to get worse over time. The patients need to have 2 chronic conditions expected to last 12 months or for life to qualify, which is most people that live here. Examples of chronic conditions include, but are not limited to, Alzheimer's disease or any other kind of dementia, osteo or rheumatoid arthritis, asthma, atrial fibrillation, COPD, cancer, depression, congestive heart failure or valve disorders, depression, diabetes, hypertension. You just need 2. So the program provides continuity of care and increased access to care. As a participant, if you are signed up for the CCM program, you have access 24 hours a day, 7 days a week to a clinical staff member. It provides residents and caregivers and their family members with the means to make contact with whoever your healthcare professional is in the practice to address both urgent and non-urgent needs, regardless of the time of day or week. Now, without this program, you have to wait for the clinic to open the next day. Now, if you're on the program, you can call somebody and sometimes get some help with things after hours, even Saturday, 10 o'clock at night, whatever time it is, to try to get you through to the next day when you can go see somebody. CCM, which is what we call the program, chronic care management, is too long to say, so we call CCM, ensures continuity of care with a designated member of the care team. So you're assigned to a specific person who's going to be kind of like your case manager, sort of, but it's a nurse practitioner. So you'll be assigned to one nurse practitioner that you're able to discuss your chronic conditions by phone whenever necessary, and when there's something that's identified based on your phone calls, then they'll also schedule you an appointment to address any issues. So this is designed to be a non-face-to-face kind of care, but it's to get on top of any issues that you have right away so that we can take care of it sooner. So if you call and you say, oh, this happened, and the person will say, oh, you really need to be seen tomorrow, we'll put you down at 8 o'clock in the morning, and then they'll try to say, do this and this for tonight until tomorrow morning until we have a visit. CCM provides increased opportunities for the residents and any caregivers or family to communicate with the practitioner regarding the patient's care by telephone, secure messaging, which is email, or we have a secure messaging service in the patient portal, secure internet or other non-face-to-face consultation methods. So it's to provide comprehensive care management, and this includes an approach to making sure that you get all of your preventive care services when you need them. So we kind of try to track that too. Your doctors do this too, so we don't want to take over anything that your doctor's doing, but sometimes things fall through the cracks. So we just try to make sure that doesn't happen. We'll help you reconcile your medications and help you identify any interactions between your medications. We'll try to help you with your self-management of medications. Like if you need any help, you have questions, or you're not sure, we'll help with that. I find a lot of times when I go just getting people's medication lists that they're either not taking their medications correctly, or they have let some refills go away that they should have done and they didn't do. So it's just good to have somebody just looking at your medications and make sure everything is the way it should be. We discuss your care and your care plan with the person who's on the service, their family, their caregivers, anybody who wants to be included in the, any part of the care. This program is also for that too. The idea is to do closer monitoring of diseases that are most at risk and providing a symptom checklist for patients. So we actually will tell you exactly what things to look for and when to call when these things happen so that we can take care of things sooner rather than later. The care plan is made based on each person's specific chronic conditions, each person's goals. If you have certain things you want to work on, we'll try to put that in the plan of care. And also if there's any barriers, like let's say you wanted to lose weight but you can't exercise at all. So we would try to figure out some way to help you lose weight if that was your goal. So we also help with transitional care management, which is coordinating between your healthcare providers. And the goal is to provide better communication and sharing of information between healthcare providers. It is really, really hard. We have all these great electronic health records, but none of them talk to each other. So you go from one appointment or you go to the hospital and you come back and everything always gets lost in the cracks. It's always very difficult and people are always getting confused which meds they're supposed to take and which meds are not. When are they supposed to go to an appointment? When are they supposed to see this doctor? So this program, we also really try to help you with that. CCM, like I said, helps to manage transition between settings. We help with referrals to other doctors, follow up after emergency department visits, or after you leave a facility. This can be skilled nursing, or a hospital, or a rehab facility, any of those places. We also try to help identify gaps in care, or see if there's any other services you need that haven't already been arranged for. Like if you come home from the hospital and they just send you this list, and you are weak because you've been in the hospital for a week, but they didn't give you a referral for therapy or home health or anything, we'll try to say, oh, you really need this, and we'll try to make sure you get the services that you need. So benefits, which you probably already figured some of these out. For CCM patients, it contributes to better health care for the patients on the service, provides a comprehensive care plan to help patients understand how to care for their medical conditions themselves, so that they can stay as healthy as possible and seek medical attention sooner. And this results in better outcomes for the patients on the service. It provides 24-hour access to medical care by phone. And the goal is to provide the best care possible, keep patients out of the hospital if possible, to minimize costs and inconvenience due to unnecessary visits to doctors, emergency rooms, unnecessary testing, just to kind of help with all of that. If you need to have the services, certainly we want you to get the services, but sometimes it's just having better coordination helps. Services can be discontinued at any time. Like let's say another doctor wants to do the service, you can call and say, I want to be off of the CCM service at any time. There's no set time you have to do it. It can be different from one day to the next. So how do you get CCM services at Westminster, and what does it cost? So you can call the Wellness Clinic for more information. We can set up a time to talk to you. If you have not had a visit, we call it a qualifying visit. It's pretty much just a visit that's not foot care or ear cleaning, just like a regular office visit. In the past year, if you haven't had one, we can make an appointment. There's other visits we can do, or we can just talk to you about the CCM service. We'll make sure you're not getting this service at your primary care office. I've had somebody who didn't know they were on this service at the primary care office, and they were. which means I didn't explain it very well to them, but we have a list, and especially Capital Medical Clinic has so many people here, we've gotten a list from them who they have on the service. We can make sure, because only one provider per month can get paid for doing chronic care management. The cost, it's billed once a month. It should be covered by Medicare or your replacement plan. If you have a copay whenever you go to the doctor, you may have a copay. And if your secondary doesn't usually pick that up, or you don't have a secondary, you may get a copay. It's usually $8 per month for the regular service. The regular service is about 20 minutes per month. Now, if you have a lot more going on, you've been in and out of the hospital, we've had to do a lot of things to help you that month. If it's over 40 minutes, it could be a little bit more. But most of the time, most people are in the 20-minute, and it's just $8 if you have to pay copay. If you have a secondary, it usually will pick it up. And that's it. Is there any, I have one more cartoon though. Okay, this says, I'm turning into one of those grumpy old women who complain about everything. Yesterday, I barked at the mailman for wrinkling my junk mail. She says, I hate being that way. And her friend says, so you're grumpy about your own grumpiness? She says, yes, it really ticks me off. Okay, any questions? Were you gonna say anything?
I can, yes.
Oh, we'll let Mindy talk.
And then, why don't you give me the other microphone, and I'll be ready to do that. Goes towards you.
See, I'm not good at technology. There you go.
Hello. I don't have a PowerPoint. I'm just really quick going to say I'm Mindy. I'm mostly over in the healthcare center. I also take care of our residents who are in assisted living. And so if you are having trouble with an illness, feeling sick, you're not for some reason able to be as mobile as you were, and you need a little extra support, but not to the point where you need to be in hospital, then you can come over to the healthcare center where we have nurses and aides, and then you have me. Like Ann and Kathy, I'm here Monday through Friday. I work very closely with the doctors, and I work very closely with these ladies, so we really try to coordinate so that in the healthcare center, we're up to date with what's been going on with your health. So if you're someone who's been seen in the clinic, and maybe you've been seeing Ann or Kathy for heart failure, and you end up in the hospital, and then you're not ready to go home and you need to come to the healthcare center, then I'm gonna be coordinating with the hospital, but I'm also gonna be coordinating with the clinic. So I'm gonna have access to records, things that you've talked with Ann or Kathy about, treatments that they've tried, what your health history is. So we're really trying to provide a better continuity of care, so you're not kind of feeling like you're starting all over with somebody. They try to give us pretty good background when you come over so that we're prepared, and get you home as soon as possible is the goal. You will see me from time to time in the clinic when I cover for them, and I don't know everybody's names the way that they do, so forgive me, but I learn quickly. And I hope not to see you in the healthcare center, but if I do, we'll take really, really good care of you.
And it does do it. Now, I saw some hands go up earlier. How about if we put the lights on, because I'm gonna need a little help.
How can you all take on this extra work when you seem to be as busy as you are now?
Kathy, are you back? I'll answer that.
So it is a little bit of extra work, but the idea is to have less work later because we're gonna keep you healthier. So we're trying to stay on top of it. And really what I try to do is just a 5-minute phone call once a week, just to check in and see how you're doing. And if you're doing fine and everything's good, that's it. It's just a 5-minute phone call. So there's always gonna be a group of people that are gonna need more attention and have a little bit more, but there's gonna be other people that don't, and then those people get well, and then there's another group of people that, you know, aren't doing well and need more attention. But the extra work is not really extra work, it's better care for all of you, and we really wanna do that. And this is one of the best programs I've seen to help do that. So it's worth a little bit of extra work. And that's why we're sharing it too now. First, I was just doing it, but now we're all gonna be doing it, so we're spreading the work out, so it'll be okay.
Any other questions?
As of now, how many people are signed up for that?
I have 16 right now. I think you have two? One. She has one, she just started doing it.
I have 3 or 4 starting this.
She has 3 or 4 this week. We just got them on board. So at first it was just me. And so I've added like 6 in the last couple of weeks. So total, I think maybe we have 20. Our goal is for 40 to start. And then, you know, we'll see how it goes. If that's a lot, then we'll just stick with 40 and maybe just add people that really, really need it. I'm identifying the people that really, really need it at first. I have a lot of people with congestive heart failure and atrial fib, because that's what I like to do best. So I'm going, mostly any of those people I'm trying to put on first, because if they end up in the hospital, it's really a lot of medication adjustments and a lot of monitoring. So I'm starting with them, but we're doing anybody we feel who can benefit from the service at first. But if somebody really thinks they need it, we don't know everybody, we don't know everybody's history. We don't know, you know, you could have been struggling for a while and we just didn't know that. So if you feel like you really want to do this service and it would benefit you, please make an appointment and let us know. And we'll figure it out.
I have another question if nobody else does. Could you talk more about the lab work that you do? Right now, a week before we go to our primary care physician, we go up there to do the blood work. Can we do that there, and how do you know what the doctor wants?
Yeah, that's a great question. Yes, we do draw a lab. We work with LabCorp, and we send our lab. We have a courier that comes to the building every evening and takes our blood to the laboratory. We get the results back anywhere between 24 to 72 hours later, sometimes a little longer if it's a culture, but they have to grow a specimen out. But what people do is they ask their doctor to send us their lab orders. And you can pick up a card from the clinic and it has our fax number on it. And the doctor's office, your doctor's office, can fax us their orders. And usually we try to find out when is your appointment and then get you in to have your lab work done in a good amount of time. So you'll get that back, and then we fax the results to your doctor's office. So that's how that works. There are some doctor's offices that have in-house labs and that they require their patients to use the in-house lab. So that's something that you have to be aware of too. But does that answer your question?
Yeah.